My name is Jacob Trumbull, and I'm conducting an oral history interview as part of an effort to archive the effects of the COVID-19 pandemic for individuals and communities in the Midwest for both the Western Wisconsin COVID-19 Archive as well as the Journal of the Plague Year Archive. Today's date is May 6th, and it is approximately 2:59 p.m. As of today, there have been 32.3 million cases of COVID-19 in the US with 575,000 deaths. And in Wisconsin, there have been 601,000 cases with 6,823 deaths. And also as of today, 32% of the total US population has been fully vaccinated. Today, I'll be talking with Lucy Hobbs. Lucy, thank you for joining us today.
Yeah, of course.
So to start off, could you give some demographic information for this study?
I am a white female.
And how old are you?
I am 21.
All right, great. And so you're going to school here in Eau Claire. Where are you from?
I'm from Somerset, Wisconsin.
Oh, wow.
Mm-hmm.
I'm from Hudson.
Oh, yeah, right next to me.
Yeah.
I'm currently in Somerset, actually.
And what is your major?
I am a nursing and Spanish double major at Eau Claire with,
Wow.
and then I was in the honors program, so I'm able to kind of, not really a minor, but it's just
A lot. So when you first heard about COVID, what were your first thoughts on it?
My first thoughts when I heard about COVID, I actually was sort of pessimistic. A lot of people didn't think it was a big deal, but I actually thought it had the potential to be a big deal. And I think that is potentially part of my healthcare background. Kind of historically, some things have kind of blown up like this. So I was a little bit worried about that. And then it ended up, becoming a pandemic.
Okay. So your thoughts didn't really change all that much about it?
Well, I guess in the beginning, like I was hopeful that it wouldn't be, it wouldn't spread to the US, and other parts of the world, and then it did. And so it was kind of like, I guess it could be, a really big thing. So although it was surprising, I kind of had it in the back of my mind that this is a potential to be something that's really big.
Yeah. So, you yourself have also been working on a different archive. Could you tell us a little bit about that?
Yes, I am currently working with the Spanish department on this same project, interviewing Hispanic farm workers in the Wisconsin farms. So it's been a really great experience because I've been able to just discuss, I guess, the topic of COVID with community members that I wouldn't normally get in contact with. So it's been really awesome. I've learned a lot, and it's been a great way for me to kind of see how myself becoming a nurse will be able to help these populations in the future and kind of help them to access healthcare. So,
And, what was your favorite part about doing that kind of project?
my favorite part was just having one-on-one conversations with people. I like talking with people. I like hearing people's stories. So learning more about individuals and their backgrounds and how they've gotten to where they are today is just really interesting to me.
And, did you have any challenges conducting the archive?
I did. So I started last semester, and at that point I was in nursing clinicals going to the farms. So I wasn't, Dr. Casey had reached out to me to be a Spanish intern, and I was kind of starting in that role, but it wasn't official yet until this semester. So going to the farms and having, doing nursing things as well as Spanish was sometimes difficult to navigate just because of time, with people coming into the clinics, and then a lot of times they needed to go to work right after, and so people didn't really have a lot of time to think about the interviews and everything. So this semester it's been a lot easier because we talk to people while they're waiting to get their, waiting their 15 minutes for their vaccine. So it's just been a great time to interview people. And then with that, we were kind of doing a lot of online interviews last semester, which I'm sure as you have found out as well this semester, it can be really difficult just to schedule a time and for people to remember the time and, for things to not come up. It's a lot easier to, I think, forget about an online appointment versus in person.
Yeah.
So it was a little bit of phone tag. And so this semester it's been easier because I've just been able to interview people right on the spot.
And why do you think that project was important?
I think it was very important, just generally for history to have an accurate representation of what COVID was like for normal individuals in our community, just having and not having like a political influence on what COVID was like or a societal influence, but really talking with individual people and how it actually affected them.
Yeah,
I
just
think, yeah.
sorry. Just
Oh, you're good.
what was going on.
Yep.
And so you're also a nursing major. Has has COVID affected any content in your nursing courses, like in terms of how to deal with a pandemic and stuff like that?
It has. I have a class that's a seminar class about innovative solutions to complex healthcare problems, and I'm a senior too, so I'm graduating in like a week. But so that
Congratulations.
thank you. I'm very excited. So that class, the content of it changed a lot because we switched from, well, I guess, we had like the content that we were going to cover in other ways, but in class, there were several periods where we just talked specifically about COVID. So that's been a change. I think generally in every class period, professors say like, oh, like the pandemic, this, the pandemic, that. So it's been almost just innervated in every part of the program almost. But I think that's similar to all classes. I think all classes are kind of discussing it, and just because it's such a real world issue right now.
Yeah, that's affecting everyone. Yeah.
Right.
And has COVID affected your decision at all to continue going into the medical field?
It's definitely it hasn't affected my decision because I still want to go into into healthcare, and
Yeah.
I still want to, do the same thing, I guess. But it definitely made me think about it like, okay, is this something that I really want to do? Because it was not fun. Even I work in a hospital in Eau Claire, and even working in the COVID unit and sitting with patients that were totally miserable. And if you took them off their BiPAP or decreased their oxygen level at all, that they were getting supplementally, they would just tank. They needed it just to stay alive.
Yeah.
So it was definitely eye-opening that this is what healthcare workers sometimes have to deal with. And it was a lot of learning on the spot, but overall I'm still like, I just can't see myself doing anything else. So that's just what I have always wanted to do. So.
And as a nursing student, have you, well, you've been working at a hospital, so I guess I kind of answered that question. Been helping out the community with trying to deal with the pandemic, like setting up testing, medical spaces, stuff like that?
Yeah, so I have been working in vaccine clinics with going to the rural farms, and then also with my clinical, we went to vaccine clinics and just, volunteering to administer COVID vaccines. And then the hospital that I work in had a emergency extra staffing kind of necessity because of COVID. So I signed up for a bunch of extra shifts just to come in and help them. And so that was kind of like almost like a float position. So what you would call the house supervisor an hour before your shift. And it was usually an 8-hour shift instead of a usual like 12-hour shift that I would work. So you'd call the house supervisor and they'd say, we need you on med surge, or we need you in the COVID unit, or we need you in the ER. So it was just, you kind of went where you were needed that day.
Yep. And Has COVID affected your community at all, like jobs, friends, stuff like that?
Yes. So with nursing jobs specifically, this is something that I was actually surprised that was happening. A lot of nurses were getting laid off, which is kind of counterintuitive because you think, oh, it's a pandemic. You need all the nurses, but you
Yeah,
don't actually, because surgical procedures were getting canceled. I guess elective surgical procedures that could be postponed were getting canceled. So all of a sudden you have, pre-op nurses that are out of work currently. You have OR nurses that are out of work, and then you also have post-op nurses. So a lot of and generally a lot of units were actually cutting down their people as well, just because people were scared to come into a healthcare setting because they
yeah,
were scared to catch COVID from hospitals, which is a totally valid fear because there were people coming into my hospital who had COVID all the time. So yeah, so generally the kind of census of patients went down for a bit in hospitals until it rose up again with COVID patients. So really the type of nurse that was needed in this pandemic was like ICU nurses, because a lot of COVID patients are on ventilators and that's
yeah,
ICU level, or med surg or ACU. So it was a specific kind of nurse that was needed. So with that, a lot of nursing students graduating weren't able to find positions for several months, actually. Thankfully, I'm kind of on, knock on wood, the tail end of COVID, I'm hoping. So at least like in its most extreme state. So I had no problem finding a position. And my classmates have all not, from what I've heard, not had a problem. But work wise, I know students in the cohorts above me had a serious problem. With friends, I mean, you can't really hang out with people.
yeah,
So it's definitely been hard to have, for me, my senior year completely kind of derailed, but also at that point, like everyone's life has changed so much. And I don't really spend time feeling sorry for myself about that, just because I know I could have been affected a lot worse. And a lot
yeah.
of people have been affected a lot worse. So just I spend more time on phone calls than I do hanging out with people.
But you need to working in a hospital and everything, just to, yeah. What have been some struggles you've seen in the community based off this pandemic?
I've seen a lot of financial struggle, when businesses were, like mandated to be closed or have a lot of reduced capacity. A lot of people struggled financially, which was hard to see because, on the public health end, you want people to be safe and you don't want the virus to spread. But on the other, side of things, it's kind of like you're weighing I guess, the bad effects of COVID versus the bad effects of financial issues and what's better and what's worse. And
Yeah,
then it's like, well, this person's in their 30s. They could probably keep their business open. They probably wouldn't die from COVID. But at the same time, it's like, but they could spread it to other people, or they actually still could die of COVID. So that was really difficult to see because being in the healthcare side of things, a lot of people in healthcare were very pro keeping things closed. And I was at first too. And then I just saw how much it affected people. And then I started being like, okay, like like in my opinion, maybe opening things up a little bit more, but keeping, the masks on, keeping the hand sanitizer, and just so that people could still make a living. And like the
yeah,
stimulus checks were helpful, I think, to a lot of people, but I don't think that was any amount of money that would really make a difference in someone's
yeah,
business closing down. So that's, I think, majorly how I've seen it affect the community. Also, mental health wise, I have seen a lot of people struggle more with mental health. I mean, I was working with a lot of students in the university, and um, it was kind of shocking almost how many students were struggling with that, because when you're in quarantine, you're not obviously able to go see people. So Just that isolation was really difficult for a lot of, especially college age students. Going off of that, also extremely difficult for older adults. Sorry, I know I'm kind of going on a tangent, but
no,
I also saw, I also saw a lot of older adults that it was just sad because they would be dying. I'm working with COVID patients in this COVID unit, and people are dying and their families aren't able to come in. They had to video call them on this iPad, and it's just like, oh my gosh, like this, like a death, like going through the dying process is such an incredibly scary thing for people. And a lot of times what patients say is a good death is like painless, and they want family there and they want, to be comfortable, and like they weren't able to have their family there, which was just very, very sad to see. Not only in the hospital setting, but also in the nursing home setting. So that was also just like honestly a nightmare for not only the patients, but also the healthcare workers that had to see people go through that. So.
Have you or anyone you known gotten the virus over the course of the pandemic?
I sure have. I got it while working at my hospital in the emergency department. I was technically not an exposure because I was in the patient's room, took their EKG, and like, I don't remember what else I did in there. I got it in last September. So I literally showed up to college, went back to work at my hospital, got COVID. And at that point, it was like, if your symptoms weren't improved, like after 14 days, and then like if your symptoms weren't improving, like you had to stay in isolation. Well, my symptoms did not improve, and I had a lingering cough because I got bronchitis from it afterwards. So I was isolated for almost 2 months because I still had symptoms of this cough, and at that point they didn't know if I was still contagious. So I would come back to college. At that point I worked as a resident assistant in the residence halls. So I went back to college, and then I had like a follow-up appointment with my primary care provider, and they're like, no, back into isolation. So then I'd go back into isolation. So it was an interesting way to start my semester. And with that, my dad actually got COVID as well, and he's a pilot, so he got it from a training session when one of his instructors had it, and they didn't know. They were wearing masks and everything, but they still were in close proximity for like 5 hours or something. So he ended up getting it too. When I got it, I had on like a mask, and I think I had on goggles too, but I didn't have a gown on. And I got it from
got on like your clothes or
something. I don't even know. I mean, the patient was coughing a lot too, so I don't know if it just it was a mess. I ended up getting it, but it's okay.
A lot of people after they got COVID reported having like losing their taste or their smell. Did you experience that at all?
I did not, which I was really surprised I didn't. The only symptoms that I had, well, I had several, I guess. I had a headache, I had a cough, body aches, and then I experienced shortness of breath, which led me to go to the emergency room like a month after I was diagnosed with COVID. And it was just shortness of breath. I mean, I had a little pulse oximeter. And so I knew my oxygen was fine, but I called the nurse line and I was like, hey, just so you know, and I also had like some chest pain associated with that. Come to find out, is probably chest pain from coughing so much and bronchitis, but I didn't know at the time. So I called the nurse line and I was like, hey, I have these symptoms, kind of hard to breathe, kind of freaking me out a little bit, and chest pain. And they're like, oh, go to the ER, go to the ER. Yeah. So I went to the ER. I've never gone to the ER before, like for myself. I've never had something like that happen to me. So I went in there, I was totally freaking out, hyperventilating, which I thought was because of shortness of breath. Ended up, I think I was just super anxious to be going to an ER for a COVID concern.
Yeah.
ended up, I was fine. They did a CT of my chest to see if I had a pulmonary embolism, which I did not, thankfully. And I was just sent home, and they were just like, come back if you can't breathe. I was like, okay. Yeah, if it gets worse, come back. And then I was, it was a weird experience because you felt short of breath. You felt kind of that air hunger, but I mean, I was keeping close track of my oxygen level, and my oxygen level was never went below like 94, I believe. So it was fine. I was fine.
Have you gotten the vaccine?
Not yet. I actually got a different vaccine, just like a scheduled routine vaccine. So I have to wait a bit. I was like, that actually is probably not the best time to do that. Like, I probably should have waited on that one and gotten the COVID one first. But anyway, I have to wait a little bit after that. And then I didn't get it right away because I had already gotten COVID. And so I was like, I'm sure I'm fine, like with antibodies. So now, once this waiting period is up for my other vaccine, I plan to get it. So I think I can get it early June.
Well, probably not you, but anyone you know have any concerns with the vaccine or about the vaccine?
Yes. My sisters, one of them is an ER nurse. She has concerns with it. Not like really concerns. She just doesn't really think she needs to get it because she doesn't think COVID is a very like big deal for her age group. Which is generally true because it usually affects, middle-aged to older individuals more. But so she just says that she's just not going to get it because she's not concerned about it. Which, coming from an ER nurse perspective, is interesting. It's actually interesting how many nurses are not getting it. A lot of people in healthcare are not getting it. From people I know in my hospital, which is really interesting in this. There's very polarized opinions on it. A lot of people that don't, especially healthcare workers that don't get the vaccine, don't really want to tell people that they're not getting the vaccine because they're scared they're gonna have backlash from it and everything. But there was a couple of instances where like one person got shingles from it just because it kind of was like a shock to their immune system, and they ended up getting shingles on their face, in their eye, like around their eye, which is a horrible place to get shingles because then there's a risk for blindness. So it was just kind of like an extreme example of like what could happen, but it happened like in our community, and so that was known about, and so a lot of people were like, no. And then I think another thing is that healthcare workers have kind of seen historically sometimes sometimes medications are recalled, and there's things that are found out afterwards that they're like, oh, maybe we shouldn't have given that to everyone. So I think a lot of healthcare workers were a little bit wary, which I was too. I will be 100% honest. I was a little bit wary of it in the beginning, and I was like, well, I've already had COVID, so I'm, I have a couple months to kind of like see what happens. And I've been watching what's happening, and so far it seems like it's fine. So I'm like, you know what? I'm just gonna do it. Like at this point, like I'm at the range where I like should get it to be protected. And from what I've seen, it would be safe for me to get it. I haven't, there's no huge thing in the news that's like everyone's getting this condition or whatever. It seems, to be very safe for the public. So
yeah, going back on that, my dad also works in a hospital, and before the vaccine started going out, he was like, get the Moderna and the Pfizer one, but not the Johnson & Johnson one.
Interesting.
Later, then it came out about how a few people had gotten blood clots and stuff like that. And I was like,
Yeah, that's smart. That's really interesting. I mean, the Johnson & Johnson one has like lower efficacy rate anyway. So even like when I was looking at, I preferably have heard like better things about Pfizer. So I'm kind of hoping I get Pfizer, but if I get Moderna, I'm not gonna complain. Like I think either one is, good. But that's interesting that he knew about. It's like, oh, Johnson, which now it's back out on the market, which is, because I kind of looked at what the issue with COVID is that it's been so highly politicized. It's crazy. It is crazy. Like, honestly, how much politicians are using it for their own personal gain or to bash other politicians. And that's not what COVID's about. So I look at that and I'm like, do you guys have any idea of like what a horrendous crisis this is for people? And then like you guys are just messing it up even more with your political agendas. Like, do what's actually safe for people. So that's been really frustrating to see. But
And what do you, so going back to, you sort of talked about mental health and how that's kind of become a crisis over the course of this pandemic. Do you think physical health has also been affected by it?
that's a really good question. I haven't really heard much about physical health in like the general population. From my own experience, I've actually exercised more and gotten kind of healthier because I've had time to. With like my double majoring and working different jobs and stuff, like I'm usually extremely busy, and like with my classes online and doing stuff all online, basically, I've had just more time to. I'm not really sure what other people have experienced with that. I know like gyms closed, which was hard.
Yeah.
So yeah, that, I mean, just based on that, I'm sure it has affected people detrimentally. But in my own personal case, I think I've been actually better.
And you going back to the politicization of COVID, how do you feel about the government's response to the pandemic?
I think it's been a total mess, personally. A total mess. I think it's hard because every single community is different. So when you tell an entire state or an entire, well, cities would make more sense, but like when the federal government is telling the entire country to do something, that's just not going to work for every community most of the time. Most of the time. Even when governors say something to an entire state, it's going to be different in communities what the needs are. So I think kind of keeping it more in this situation. See, I'm not like a political science major, and I don't pay that much attention to politics just because it stresses me out. But just like, oh my gosh, all this stuff that's going on. But I think a lot of things could have been done differently. And I think keeping things closed for the amount of time that they did was really detrimental to a lot of people, probably more so than opening earlier and having just more protections for vulnerable populations would have been. Now that is an extremely debatable opinion, and I could totally be wrong on that because I, again, don't know everything about politics, nor do I never will. So just from my viewpoint on it, I was kind of like, when things were still really, really closed, I kind of wished companies were able to continue to pay employees and to continue to have people at work, because I saw families firsthand suffering from that. And that was really hard to watch. With the vaccines, I think that was a really cool thing to see all of these people working together to get a vaccine. That I think was probably done to the best of their ability to get that out, because it was really fast, which was another sort of concern I had about it. I was like, ooh, that was like insanely fast. But at the same time, like they had like the world working on it. That's just what needed to happen. So that I think was probably a good response. I'm trying to think of all of the other things. The stimulus checks, I hope they helped people. I saw a lot of memes that were like, "Oh, I got my stimulus check. I'm gonna buy the PS5," or I don't know whatever that new video game thing is. And I was like, "Oh my gosh, that's not what they're meant for." But like that much money for struggling families, like if people were actually struggling to pay rent and actually, I think it would be like enough for like food for a couple months, but like above that, I don't know how.
Maybe rent for a month.
Yeah, like it just didn't seem to be adequate. I was kind of like, like they're trying to do something, but I don't know if they were just trying to do something to say, oh, we try to do something instead of actually making a difference. So yeah, overall, I think the government has highly politicized this issue and it's been extremely disappointing to watch. And that's about where I stand on that. Like do things for the safety of everyone and not for your political gain. That's kind of where I get annoyed. So when I see that happening, but
Has your experience with this pandemic transformed how you think about like friends, family, and your community?
yeah, I would say so. I think just thinking back to like how gatherings used to happen and like concerts and movie theaters and just all of the things that people did, it's like wow, that I can't even, that's not even on my radar at this point from the pandemic. So I have a greater appreciation for spending time with my friends and family and just like having things normal like they were before. Now, if that ever actually comes back, I don't know. Maybe there will be like the new normal, like a lot of people are talking about. So I have no idea how it's going to look in the future, but that I just think that gives me some more appreciation for how things were. That being said, there's a lot of things that I'm kind of like happy that aren't happening anymore. Like even like at church services, like I'm very religious, and at church services when people would like shake hands for like
Yeah,
this,
that's the beginning. Yeah.
I'm like, oh, like even before COVID, I'm like, oh, I don't really want to touch you. Like, I don't know where you've been. So it's just kind of like that. Even I just didn't really like sharing, I guess, like in makeup stores having the samples of makeup. That's gross. Stuff like that. I kind of like the higher sanitizing.
Yeah.
And what we've seen is that flu cases have severely decreased this year because people are actually trying to be cleaner and more conscientious about not spreading germs to each other. And I hope that continues into future years because the
Actually
flu,
washing their hands.
yeah, like it's disgusting how many people don't wash their hands. Like it's gross. I'm like, people, like this is like serious. I mean, it's just literally public health, but okay. And like I just hope that the flu continues to not like be as severe because that's another thing that kills a lot of people. So if we can, eliminate these things from being spread or at least minimize the spread, that is always better in my opinion. So
And what do you think will be important to take away from this pandemic? That will be important to remember for the future if there's ever another sort of pandemic like this one.
I ask people these questions all the time, and a lot of times I'm like, I don't know how I would answer that even myself. Like the governmental response, I don't really know how I would answer that. Like this one, it's very difficult because there's a lot of things that went wrong with COVID, but I don't exactly know how to make them better. Like maybe taking it more seriously earlier on and there was a lot of like, COVID's not real, the government's just trying to control you. And it's like, are you kidding me? Like you go to the COVID unit and you look at those people that can't breathe and tell me it's not real. So I guess having people actually take things seriously and take precautions, that would be a good response in the future. As far as like governmentally, I mean in one aspect, I think they probably did the best that they could with the knowledge that they had. because at the beginning it was so unknown what COVID even did to people and how bad it really would be. We didn't know how many people were going to die from it and what age groups would be affected. So I think the initial shutdown was prudent to do, and to just make sure that this was not going to become this, well, even though it kind of did become this major crisis, but they were trying to prevent it from getting worse than it did, I guess. So I guess for future pandemics, which honestly probably will inevitably happen,
Yeah.
because of geography and the amount of travel and just general world things that are happening, I guess just take it seriously and crack down on precautions right away and hopefully get people to comply, because if the people don't trust the government and don't trust, I guess, the scientists, then there's literally no public health, because you can make all the vaccines you want, but if people don't get them, it's not going to make a difference. So I guess building up that trust among the public is really crucial to the safety of the community.
Well, that's all the questions. Thank you for your time and cooperation with this process.
Of course.